Right. I am very well aware that I'm up against Bake Off, and I know that doing this at 8 o'clock at night is ridiculous, and only a true influencer could ever get any followers at this time of night. And clearly, I'm not one. Joking. I'm joking because look at that, Instagram's loads of people. Facebook not so much, but still kind of everything. So good evening. It's late tonight, and um, it is late tonight. Why is he late? You're saying to yourself. I'll tell you why I'm late. I'm late because I've been called back in to surgery, and normally hair and makeup. Yes, that's right. I was doing. I've got to be honest. I need my haircut, don't I? It's gone mad. It goes mad at the sides. Starts going over my ears. Ridiculous. Hi Elaine, good to see you here this evening. Normally, these are people's questions, but this first one, I'll be honest with you, full disclosure, I put it in. Right? No one's actually asked me this question, but I put it in. Do we do surgery on Mercury's in retrograde? Because I've been called back in this evening, and I'll be honest with you, I think it's because Mercury's in retrograde. And this, I don't know if we've got any spiritualists out there. I learned this many years ago from a patient who said to me, you know, how's things going? And I said, yeah, well, fine. But in reality, there's some issues, and the front of house person had some issues with a boyfriend and things like that. And she goes, oh, yeah. She says, I feel terrible because Mercury's in retrograde. And ever since then, if ever things are going badly or feeling, you think, oh, God, I don't feel great or whatever, it's because Mercury's in retrograde. And I'm also just verbalizing this. You're not supposed to make any big decisions or do any big sort of sign, buy a house or anything. I'm thinking buy a new bike, and I wonder if I should wait until Mercury's out of retrograde because of my condition, age, basically. Full disclosure, I'm thinking of getting an electric one. Yeah, you heard me. My son is not happy about it, but I think it will help me up the hills. I mean, the hills are a killer anyway. And I'm thinking, should I wait before pulling the trigger until Mercury's out of retrograde? But they're really hard to get these days, bikes. They're really there's not many around and things. So I don't know. But back to the question, do we do surgery in Mercury's retrograde? I'm seriously thinking about not doing surgery while Mercury's in retrograde because, if well, I should look at it scientifically, really. But I was about to say, if ever I get called in and stuff, it's when Mercury's in retrograde. I'm not sure if scientifically that's true, but it does sort of feel like that a bit. So, so that's why I'm late tonight. I'm late tonight because I got called back in. Mercury is indeed in retrograde. I'm not sure when it's coming out. Any spiritualists out there know when it's coming out of retrograde? I think it's quite soon because I think it's been in retrograde for a while. So hopefully it will turn the corner soon. But clearly no spiritualists out there. It's just me, isn't it? Okay. Shall we move on with the other question? I don't think that question landed really. It didn't land as well as I was expecting. A flurry of activity, to be honest with you, of people agreeing with me. Charlotte, are you agreeing? Good evening. No. Anyone else agreeing about the Mercury thing? Anyone else feeling it? No. Just me. Okay, right. Well, this is a real question now. Not the other one wasn't a real question. It was just a real question from myself. Do you have a procedure? How long have I got? I've got 2 minutes before Bake Off starts. So, do you do the procedure where I can have a dimple in my cheek? No. There is such a thing, and you dimples here and here, and really that is, I mean, the most of the work we do is breast and body contouring, and that is where we specialize, and that is where certainly I specialize. Now, we have got other surgeons at the clinic who do more facial work and will do things like blepharoplasties, ear correction, and but the answer is no to that. That is a procedure that can be done, but that's more of a facial plastic surgeon you're probably looking for that. In a similar way that I would say for breast, many surgeons can do breast augmentation or breast reductions, but if you have something a little bit niche, a little bit different, asymmetry, difficult chest wall deformity or some problem like that, you're probably better off looking for a specialist in breast. And if you have a face thing, look for a specialist in face, not this guy, So yeah, we don't do that. We don't do that, but it can be done. Charlotte, what is your favorite surgery to do and why? I have been asked this question before, and I don't know if I'm supposed to come out with a bang-in straight answer. I'm not sure. My gut feeling to answer that question is tummy tuck, because I think tummy tuck's a great op. Great taking those big bit of skin off, contouring the abdomen, really nice results. So initial response, boom, tummy tuck. If I have time to think about it, breast augmentation is up there in terms of doing the surgery. And I think that's one of the things with this job is it's about doing the surgery and about working with patients. And I think it's easier working with tummy tuck patients than breast augmentation patients. So pure surgery, breast augmentation is up there because again, you can see it's much quicker. Tummy tuck's quite a long op, so breast augmentation is relatively quick, so hour and a half. Sometimes it can be tricky, like anything. Just when you think you're good at something, you think, oh god, this is a tricky one. So you do get tricky ones, but it's a nice operation, and again, instant results, fantastic. It's an instant thing. It's not subtle. Breast reduction, I guess, is also. But anyway, out of the breast, I think breast augmentation probably is up there. But the problem with breast augmentation is it does take a lot of work post-op to get people through because it often doesn't look right to start with. They can get problems and issues, and you have to get them through that the good first few months. So that is quite stressful. Which you get less of with tummy tuck. So yeah. So probably tummy tuck would be my answer to that one. What's going on Instagram? Instagram is kicking off. Hi, my implants were placed under the muscle 6 months ago and I suffer from a really bad animation deformity. Is going over the muscle the best option? My surgeon offered me this solution recently. As well as lack of cleavage, would going over the muscle with bigger implants, currently HP 500, help me to achieve better cleavage, please? What's your opinion? Thank you. Anya, thank you. Difficult problem, Anya. The reason it's a difficult problem is because your surgeon went under the muscle for a reason. And I'm assuming you haven't got much subcutaneous cover over your chest, and they're worried that you'd be able to see the edges, feel the edges, potential for visible rippling if they went on top of the muscle. I'm assuming that's why they went over the muscle, because that's the thing. You've got to think, why did they go over the muscle? Because there are definitely benefits of going over them under the muscle, mainly in terms of the fact you get a better cleavage or at least less, not better cleavage in terms of the enhancement of the cleavage, but in terms of being able to see the implant. So you've got to balance those risks. So the answer to your question, Anya, if you have got animation deformity, yes, the best way to treat that would be to take the implants from under the muscle and put them on top of the muscle. But you'd have to worry about potentially rippling, potentially seeing and feeling the edges of the implant, particularly, Anya, if you're saying you want to go bigger, because that is a worry. Harry, Jackie, that is a worry if you want to go bigger, because rippling means being able to see the implant, and it was always a balance between implant and breast, and the more that balance is in favor of the breast, the better. I.e., if you've got a smaller breast and a smaller implant and a bigger breast, that's going to be good. As your breast to implant ratio comes more in favor of the implant, so if you're getting an even bigger implant, there's even more chance of being able to see or feel the edges of the implant. And yeah, so I would be worried about going bigger, to be honest with you. If you're going from under the muscle to over the muscle, I would be worried about going bigger. I don't think bigger will help you get a better cleavage personally. It's difficult without seeing you and seeing your result and what have you. What I normally say, the cleavage, the distance between the cleavage between the breast is the same pre-op as it is post-op. But what happens when you put implants is that angle is enhanced, so that is a sort of steeper cleavage after implants. The problem with putting under the muscles, if we don't relieve the muscles enough, it can push the implants wide. So that might be the case. If your cleavage is actually wider post-op than it was pre-op, it might be that your surgeon hasn't released the muscle enough that's pushed those implants laterally, and so that would be improved by putting them on top of the muscle. Whatever implant you have, having a bigger implant will not improve it more, although it might make the angle steeper, but it would increase your risk of being able to see the implant in terms of rippling or feeling the edge of it. Tricky one, Anya, tricky one there. You've landed a tricky one on me. Difficult. I think putting them on top of the muscle would solve the animation and would potentially make the cleavage better, but it might make you have rippling, bottom line, if you're very slim. Presumably that's why you had the implants under the muscle, because you are slim, I'm presuming. But there must be an option. Maybe there's enough cover to put it because your surgeon's offered that. That is a tricky one, Anya, and I'm going to say good luck to you on that one. Thank you for the question, very, very much. Thank you. Do we do ear fold technique? Now this, looking at this is all, yeah, face. So ear fold technique is a little metal, actually, what is it, titanium, I think it is, little clip that goes on this bit here, which is called the anti-helical fold. This, not this, that's the helical rim, and this is the anti-helical rim, or the anti-helical fold. And the little clip, it's like a little, you know those clips you get that go around like paper, big things of paper? It's like a little metal U-shaped clip. It seems to be a good thing, and we offered it when Mark Lloyd was working here, but he doesn't work here anymore. I say here, I'm at home at the moment. I'm not in the clinic there. So the answer is no, because only certain people can do it, and Mark's one of them, and so we don't do it anymore. But we do otoplasty. We do reshape ears with the more traditional technique, which is the scoring of the cartilage and bringing the ear back, which is a more extensive procedure which can correct the ear more. You've got more options with doing that surgery, although it is more invasive. So in the right candidate, the ear fold can be a good thing, but the ear fold's not for everybody, whereas an otoplasty is pretty much for everybody. Anyone can benefit from an otoplasty because you can sculpt and you can reshape the cartilage with much more width of what you can do, sort of thing, than with the clip. But nevertheless, I think there is a place for the clip, and as I say, we did offer it for a very short period of time, and I thought it was a good idea. I don't know how much it's taken off. It was developed by a plastic surgeon. I hope it's taken off. It's good that someone's asked the question, because he's obviously getting his marketing out there. I hope it's taken off, because I wish him well with it, but we don't offer it at the clinic, although we do otoplasty. Do we offer lower eye bag surgery? Now, this is an interesting one, because we do upper eye bag surgery, also known as blepharoplasty. Again, Kurum does this. I don't do this. Lower blepharoplasty is a much bigger, I'll say much, bigger, I won't say much, I'll just say bigger, a bigger operation than upper blepharoplasty. So an upper blepharoplasty can be done under a pure local anesthetic, and we've got that facility in our clinic. A lower blepharoplasty usually needs more than a local anesthetic. That will need local anesthetic with sedation or a general anesthetic, because it's more like a mid-facelift to lower blepharoplasty. You tighten the cheek. An upper blepharoplasty is just taking the upper eyelid bags away. Certainly a lower blepharoplasty is less common than an upper blepharoplasty, but we don't do the lower blepharoplasties at the clinic because you need more of an anesthetic with those. You would need, as I say, a local with sedation or a general, because you tend to sort of undermine and do things with the bags underneath the eyes, as well as tightening the skin. So an upper blepharoplasty is just purely a skin procedure, whereas a lower is skin and muscle and fascia. So yeah, we don't do that one at the clinic. Can we offer tattoo excision for a foot tattoo? Now, this question has been asked because of someone who sent in a photo of their foot tattoo, and they wouldn't let me show it. But anyway, it's on the dorsum of the foot. It's on the top of the foot, assuming this is a foot. So it's on the top of the foot here. Really bad place for a scar. Now, I guess you could say we do tattoo excision at any part of the body because it's about taking a bit of skin off, and we can take a bit of skin off any part of the body, doesn't matter where it is. I'm trying to think, there's no part of the body that you wouldn't take a tattoo off. Eyeball actually is one. Eyeball tattoo can't do, but as long as it's not on your eyeball, yeah, we can take that bit of skin off. The problem with the dorsum of the foot is it's a really bad place for a scar. There's constant trauma. You're putting your shoes and socks on, constant trauma. And this person has actually sent us a photo where they pinched the skin and said, look at this, the skin is pinched. The thing you got to think of with the foot, and it's the same with the hand, is the foot's got to move. So it's all very well saying, oh, I've got loads of spare skin on my foot, but you got to, as soon as you stitch it up tight, as soon as you start walking, it'll be under tension and there's risk that the wound can open up. So you'd be surprised how little skin you can remove on the foot and also on the dorsum of the hand, the same, without it being really tight. So we do it, but it's a really bad place to have a tattoo, and to have it, well, maybe not a bad place to have a tattoo, but it's a bad place to have it excised. It's a bad place to have a scar. So not going to be massively positive about it. Abs shouted you out. Francis is here. Shout out to Francis. Can you remind me of what BMI you need to be below for surgery? Abs leading question. Oh, someone's asked a question. That's reminded me, Abs. Oh God, I've pressed the wrong button. Anyway, Abs. Here we go. Yeah. Abs. I'm going to throw that back at you, Abs, to say what surgery you're talking about. Because if you're talking about a mole or, some kind of local anesthetic minor procedure, a nipple correction or something like that, BMI is not in the book. It's not there. Doesn't matter. Whatever BMI, unless it's crazy big and you worry about the operating table, but if it's a bigger op, like something like a breast thing or a body thing or something, particularly something that needs a GA or something like that, then the BMI does matter, tummy tuck. So then the BMI does matter because the two things for the BMI. One is if you lose weight after surgery, it's going to change the shape of your body. So if you you really want to operate on a stable platform. You don't want to operate on something that's moving, there's something that's changing. So ideally, you want to have it stable, number one. So you want to be stable, number one. So regardless of what the number is, you need to be stable. So if you're not stable, if you want to lose weight or if you want to put on weight, if you're not happy with your weight, you're better to get it where you're happy first. So number two, there is an absolute BMI number, which is 30. That's the 30 that most people talk about, but it's not written in stone, 30. It's just that that's what they've chosen when they've done studies, and they say, look, your risk of complications is higher when your BMI is higher than 30. So ideally, if you can get a weight lower than 30, that is better. So 30 is the number. But as I say, even if you lose weight below 30, if you want to lose weight, or as I say, if you want to put on weight, you're better to do it before surgery, particularly something like a tummy tuck, because we can make the skin really tight when we do a tummy tuck. But if you lose weight afterwards, we could have made it tighter and you might have a bit of lax skin. So I understand the argument that I can't exercise and stuff with all the tummy there, but that is that is the thing. 30. Francis, hey, look at this. Shouting out Francis, and this is what. Thanks for the best stars, Kate, and being the most friendly surgeon on the planet. My God, didn't expect that, Francis. Taken aback. And look at this. Vicky's got a shout out as well. Shout out, Vicky, in the house. Vicky for being so helpful and lovely. Well, Francis, thank you. I do try, Francis. I do try. It's difficult, and it takes time to get things right and to get things to settle. And well, thank you. I like to think that we're in it together, and we good. That's kind. Flushing there, right? Okay, thank you. Haley D Picks. I had a BBRA. Nice comment, Haley D Picks. Nice one. Wow, that's kind, isn't it? So, that Mercury's in retrograde, but lovely comments from Francis. Thank you, Francis. Right. Oh, I've got the wrong thing on the screen for the Facebook. Right, here we go. Look at this one. I had a bellini lift. It's not a bellini lift. It's but Benelli. It's Benelli, not Bellini. I had a Benelli lift. And my areolas definitely stretched out, which I was told after was normal. My question is, can you reduce areolas? Spelt wrong, spelt differently both times. Anyway, we're just gonna gloss over that, guys, and keep them smaller. Also, what technique could be used to stop them stretching? So, can you reduce areolas and stretch? Yes, you can. So, this patient sent a photo. I didn't even ask to show the photo because I don't want to get in trouble with Facebook and Instagram, because I know what'll happen. I'll get banned if I show photos with nipples on. So I've got to cover the nipples. And I thought, if I cover the nipples, you can't see the areola. Anyway, I don't want to go down that route. I have been on the wrong side of Facebook, and actually I haven't been banned from Instagram yet, but definitely been banned from Facebook. So I'm not going down there. Keep the breasts off the broadcast. But anyway, this patient, I don't know if you're out there. Well, obviously you're out there, but I don't know if you're watching this. I've got to be honest with you. I think the areolas are actually pretty well in proportion. Well, I didn't do the. I'm not saying because I didn't do the surgery. I didn't do the Benelli lift, but whoever's done it, I think it looks all right. But in answer to the question, can they be reduced? Well, yes, they can be reduced. And what technique can be used to stop them stretching? Well, what I tend to do, and people are split on this. And if the fact that people are split means there's no best way, so I'm not telling you my way is the best way. Because if my way is the best way, everyone would do it. Let's face it. I use a permanent suture. To keep that areola small. It's a clear proline. It's a clear permanent suture. It's very, very, well, let's say very rare, but it's quite hard to get because most permanent sutures are colored, because most permanent sutures have to be removed. But this is a clear permanent proline suture in order to keep that areola down and avoid it from stretching. It can stretch whatever technique you use, but that's how I try and reduce the risk of it stretching. Now, you might say, why doesn't everyone use a permanent suture? Good question, I'll say to you. The reason everyone doesn't use a permanent suture for two reasons. First of all, it's permanent. So if you can feel the edge of the stitch, or if you can feel the knot or something like that, you're always going to be able to feel it. It's not going to dissolve. So if you can feel the knot, we try and bury the knot as much as we can, but if you can feel the knot, you're always going to be able to feel that. So that's a problem. The second thing is, when we tie the knot, we try not to put too many throws on the knot. I don't know if you know what I mean by a throw. A throw is like that. When you do a knot, when you do your laces, that's one throw, and then you do those two loops. Yeah, so we do several throws to make it more robust. But if you do too many throws, you're more likely to feel it. But if you don't do enough throws, if that knot comes undone, then you get recurrence of the areola. The stretched areola. So you are relying on that knot. So that is the downside of it. So not everybody does it that way, and people use barbed sutures and long-term dissolving sutures and other techniques. But I use the permanent suture because I feel that's the best way to stop it from stretching, in my view and in my experience. But nevertheless, it can still stretch even with a permanent suture. A, the knot might go, and B, there might be some give in the tissues. So there's still a risk of recurrence even with the permanent suture. That is a risk with an areola reduction. And just my private journey agrees with Francis. Best surgeon, Facebook, you listening? Best Instagram is saying this guy's the best surgeon. And Vicky is amazing too. Best surgeon, best nurse. What a duo. Unstoppable. We're an unstoppable force. Did I go through that a bit quickly? I feel like I might have done. But you know what I'm saying? We all know that time's kicking on, and we haven't got, time is limited. Let's face it. We've got so long. And I can hear it. On next door. Have we got any? I'm done in. I'm quite frankly done in. I'm overwhelmed by Francis and my private journey. Overwhelmed by the support, and I am sorry I'm late. Do apologise. Try and do better next week. Oh, Corinne's on. Oh, Corinne's on. Another look at this. We've got Facebook positivity. We've got Instagram positivity. We've got Facebook positivity. Come on. 100% best surgeon. That's why I've chosen you for my surgery in December. Yeah, big up yourself, Corinne. Bloody good choice, Corinne. I think Instagram people would agree with you. That's jolly good of you, Corinne. I won't let you down. Thank you. 100%. I would I would have preferred 110%, Corinne, actually. But you know, I'll take 100. I'll take 100%. I'll take that. You know, but I only worked 110% personally. Yeah, I give 110% in everything that I do. Yeah. Tasha, what can we do to help? Oh, yes, that's Tasha. Thank you. Sorry, that was the question from the stories. What can we do to help swelling post-op? Did you ask the swelling? Did you ask the thing on the question? Yes, I did have another question on the thing, the way you're supposed to ask the questions. So if that was you, well done. If it wasn't you, whoever asked that question, well done. So throw it right back at you, but I think I know the answer, but I'm going to throw it back at you and say, what's the surgery? Because that's the first thing I was going to say. Nebulous question, Tasha. You did ask, right? So let's just say, for example, some kind of body contouring surgery like arm lift or thigh lift or something like that, shall we? What can you do to help swelling post-surgery? So there's several things you can do to reduce swelling post-surgery. I know. That's what it was. I was just saying that. So first of all, compression. Compression is good for surgery if you can put compression on. So things like tummy tucks, mastopexy. Tummy tucks, you have a binder on. Mastopexy, you have a bra on. Gynecomastia, you have a sort of vest on. Arm lifts, thigh lifts are difficult. It's difficult in my experience to get compression. You can get compression on the arm. First of all, the compression has to go past the joint. So it has to go past the elbow and it has to go past the shoulder. So you have to get the compression. It has to be sort of quite long because the problem with compression is the potential for swelling past where it stopped, if that makes sense. So, you know, if you stop here, you're going to get swelling past it. And the problem I've got is the armpit. It's always difficult in the armpit because the swelling, the garments are often sort of empty in the armpit so that you can move the arm. But I just worry that there's potential because the incision goes up into the armpit and there's an L there. So I worry about that. So a garment is a potential, and we can talk about that. But I don't routinely use garments for arm lifts or thigh lifts. I don't use garments because of that reason, because they can be constrictive of where the garment stops. So compression is number one. Number two is elevation. That might be a bit extreme, to be fair. So what you're doing with elevation is you're trying to get it above the level of your heart. So your heart's sort of here. So if you can do it like that, you know, the arm is going to be above the level of the heart because the heart's here, sort of a lot of the arm. So just if you're sitting watching telly, it's difficult when you're both, like that. Or if you're in bed, above the vertical height of the heart. So if you're in bed, if you're lying with your arms on pillows, I don't know if that makes sense. So it's still above the heart because you're lying down. Yeah. So elevation is good. Good to keep everything circulating. The blood flow, the arteries, the veins, but also the lymph. So keep everything moving. Keep your hand moving. Don't do stuff. So don't go lifting because that's going to make the swelling worse. So you don't want to go do anything active with your arms, but certainly keeping everything moving, keeping everything circulating is good to keep it all circulating. So keeping it circulating, elevation, and as I say, compression is good for certain areas, but on the arm lift, I find it's always a challenge. The other thing you can consider, although again, I don't particularly recommend it, Tasha, is the hot or cold. So hot or cold can help. So hot water bottle or sort of, you know, ice, but maybe not ice, frozen peas. Two things. First of all, not directly. So particularly with the frozen peas, not directly. Wrap it in a towel or wrap it in something so that there's not direct contact on your arm. But secondly, the problem with hot and cold is that you've often got abnormal sensation after this surgery, and there's a potential you can burn the skin, and you can burn it with the hot or the cold. So you have got to be a little bit careful with prolonged and sort of falling asleep with a hot water bottle on it and stuff. So therefore, I would advise caution. And again, I don't particularly push it. So the things that I would push is elevation, and moving. Yeah, that's what I would do. Yeah, keep it moving. See what I'm doing? Keep it moving, keep it elevated. Simple as that. Maybe a bit of that every now and then. Yeah, I should do a video on this. This has got a YouTube video. I mean, that is going to go viral. What to do after an arm lift. Yeah, got it? Elevate, move. And Tasha, if you're worried, you know what to do. Yeah, get on the blower, give us a ring, drop us an email, take a photo, send it over. Come on into the clinic. I'm there tomorrow. Drop in. Well, don't drop in. Give us a ring. Let us know you're coming. But definitely come and see us if you're worried, Tasha, because it's been 2 weeks, 3 weeks. So it's been a few weeks. So if you're still swollen, give us a ring, and or drop us a photo, drop us an email or something like that. And as I say, just come in and we'll have a look. Just make sure everything's okay. But yeah, it is swollen. It's a big op. It is swollen, and it will be swollen for I'm going to say a couple of months, Tasha. I mean, not really badly, but it's going to take ages for that to settle, and it will get better every day. But it does go up and down a bit. As you feel better and you do more, it does swell more. So thanks for the question. I'm sorry I almost missed it, because I did see that or someone had asked that question on the proper little box that I put on there. And thank you for doing that. And I feel bad that I nearly missed it, but well done you for doing it in the appropriate place. Is there any others? Oh no, I just pressed the wrong button. That one. No, that was the one. I can either delete or report it. I want to do neither. I want to answer it, and I have answered it, Tasha. So get involved, Tasha. Let us know how you're doing. Give us a ring, or because I want to know how you're getting on, because I'm interested. Because I'm that kind of guy. Ask Francis, I'm friendly surgeon ever, apparently. Yeah. So I'll take that. I need to. Corinne, you have. I mean, that is. What's it called? It's that thing on Instagram. They do it. What's it? Nicole Scherzinger does loads of them, doesn't she? She does loads of stuff like that, and she gets loads of likes and stuff. That's what I need to get into, like what she does. Get the appropriate music. I could do one for thigh lift, post-op movements, breast augmentation. Not so sure, but that is a winner. That is a winner. Watch this space, guys. That is coming soon, because we're going to get some music, maybe get a few of us, a bit of a routine. Yeah, I got it all. It's all whirring up there. It's all happening. Definitely. Make a note. Yeah, do the arm lift thing. Yeah. Okay. Make a note of that. Good. Any more for any more? But do get in touch, Tasha, because I'm interested in how you get on. In fact, we'll get in touch with you. Get in touch. There you go. Make an arm lift dance thing and get in touch with Tasha. Okay. Anyone else? Thank you all for coming. And I'm going to be here next week. Hopefully at the same time. Definitely at the same place. I expect you to be here too. Cat Whelan's just joined. Cat Whelan, what are you playing at? I was here. I know I was late, but this is ridiculous. What time is it now? 8:27. Yeah, 8 o'clock. What time did I get here? 8 o'clock. 7 o'clock next week. Hopefully, fingers crossed, I'll be here. Watch the replay, Cat Whelan, because it was excellent. I think everyone on this broadcast will agree with me. Both of them. And I'll see you then next week. So Facebook, I'm going to check.